can have both benign and malignant tumors. However, remember that malignant tumors are much more than that of benign tumor. Benign tumors are adenomas, okay, that usually present on the cortex and form about 40% of, or it can be found in 40% of adults on post-mortem examination. Why? Because usually they are small and they do not cause clinical manifestations, and that's why usually can go unnoticed and only be found on post-mortem examination after death. The most important thing is the malignant neoplasm, and this is renal cell carcinoma. This is the most common malignant neoplasm of the kidney in adulthood, particularly in middle age and beyond. Another important neoplasm is called nephroblastoma or Wilms tumor. This is the second most common. However, this is different because it occurs in children, okay, and in young age. Very important type of benign tumor is oncocytoma. Oncocytoma, it is a benign tumor that arises from the cells of or intercalated cells of the collecting duct, and it represents 10% of renal neoplasm. What's its importance? Because it can mimic that of malignant neoplasm. Actually, any mass present in the kidney is significant and should be identified whether it is benign or malignant. So oncocytoma كمان to present as a mass, cortical mass, and it can mimic that of carcinoma. Characteristically, this neoplasm, it has a genetic abnormality, which is the loss of chromosome 1 and Y, which is quite characteristic of this tumor. Remember, previously we depend on the appearance or microscopic appearance of the tumor in our differentiation. However, nowadays there it was clear for everybody that different types of tumor, they have characteristic genetic mutation, and actually we need sometimes to go and to do some genetic study in order to reach a correct diagnosis. A tumor might show some overlap and features that might be seen in more than one type. Oncocytomas are characterized by having an increase in color, and that's why they appear darker than the surrounding kidney tissue, and this is due to increase in the number of mitochondria in the cytoplasm of neoplastic cells. An increase in the number of mitochondria gives a bright pink color of the cell, which is reflected on the color of the whole tumor. Another characteristic thing about oncocytoma is the presence of central scar, and this can be evident on radiology, and that's why radiology might be helpful in differentiation. And if there is a central scar, usually this is our diagnosis should point to the this type of tumor, which is oncocytoma. And this is evident also on gross inspection and microscopic examination of the tumor, and we find the scar in the middle of the tumor, which is quite characteristic. Very important type of tumor, it is renal cell carcinoma. Renal cell carcinoma, it is derived from tubular epithelium, and this type of tumor predominantly located in the cortex, any site in the cortex, and it is the most common because it represents 80 to 85% of renal neoplasm, and also it represents 2 to 3% of all cancer in adults. Most common age of affection, it is 6 to 7 decades of life. Males are affected as twice as females. There are risk factors: smoking, hypertension, obesity, also exposure to heavy metals, cadmium, the presence of polycystic disease, acquired polycystic disease commonly caused by obstruction زي stones مثلا, increases the risk up to 30% of that of normal. طبعا في عندنا genetic mutations that are characteristic as we are going to see. Renal cell carcinoma subclassified into three types depending on microscopic appearance of the tumor into clear cell carcinoma, which is the commonest, papillary renal cell carcinoma, and Chromophobe renal carcinoma. طبعا, this subclassification primarily it is dependent on the appearance of tumor cells. However, also genetic abnormality or gene mutation characteristic of each type is also important. Regarding clear cell carcinoma, again, it is the most common type. It represents 65% of all renal cancer. It can occur in two forms, either sporadic, which is non-inherited, and the inherited form. Inherited form, it is related to gene mutation, and this gene is called von Hippel-Lindau gene, as that of the disease itself. These tumors, as the name implies, composed mainly of clear cells, and these cells are relatively large with clear cytoplasm. عشان هيك نسمى as clear cell carcinoma. Von Hippel-Lindau disease, it is inherited disease, inherited somal dominant, and this condition is characterized by having different types of tumors. One of them is hemangioblastoma, which is not one of the common tumors. Hemangioblastoma, it is a tumor that occurs in cerebellum and retina, in addition to other tumors like renal cysts, which can be bilateral and multiple. And also these patients, they have clear cell carcinoma, and up to 40 to 60% of the patients with this disease, they develop renal cell carcinoma. What is the importance of these genes? Von Hippel-Lindau gene, it is a gene present on chromosome 3. Mutation, like any other gene, can involve this gene. It is either inherited or it is acquired, depending on the condition. If it is inherited, usually it is inheritance of one allele, which is going to be followed by the mutation of the second allele, and this will create a condition of homozygosity of gene mutations. زي ما تعلمتوا, this is associated with development of carcinoma. This gene is located, زي ما حكينا, in chromosome 3, and the second, in cases of inheritance, occurs inevitable. Or occurrence is inevitable. عشان هيك these patients with inherited condition should go in presentation at younger age group. While the sporadic condition, the development of gene mutation, it needs time. خاصة إنه we need mutation in both alleles. عشان هيك presentation of the sporadic or acquired form of disease بيصير إيش? A little bit late. فعشان هيك the patient, when he presents and he in young age group, we should think of some inherited components, and we should look for other possibilities اللي هو في عنده other types of tumors and so on. Von Hippel-Lindau gene is responsible for encoding for a protein. The main function of it is the degradation of another protein اللي هو a transcriptional protein. اللي هو الهايبوكسيا induced factor. الهايبوكسيا induced factor, it is a transcriptional factor. أنتم بتعرفوا by now that cell division is initiated by attachment of a transcriptional factor to DNA حتى يصير في عندنا replication of the DNA. This gene product of the VHL gene is important to exert a control on the hypoxia-induced factor. Why? لأنه if the gene mutated, the hypoxia-induced factor can escape degradation, and this will cause accumulation of this protein. When it is accumulated, this can initiate the process of nuclear signaling, and this can also be associated with the another growth factors المهمة in the carcinogenesis هي vascular endothelial growth factor. This process can give us a continuous signaling of the nucleus for division. And this is the mechanism by which the gene mutation induces the carcinogenesis. طبعا ممكن يكون this is a single gene, and you know by now our knowledge about the exact mechanism of carcinogenesis or mechanism of is incomplete, okay? And you should expect this is the important mechanism of gene production, mutation, and the cancer involvement. However, there should be other gene mutation, okay? It can involve other chromosomes. يعني لهلا ما نعرف إنه each tumor which exactly what are the mechanism or the gene involved in the carcinogenesis. Grossly, this is a kidney which is cross-sectioned, and a tumor. You can see that a tumor is a sphere. It is present in the cortex, لأنه هذا هو الكورتكس of the kidney. وهاي المدلة تاعتها اللي بتكون باللون الأصفر. This is a tumor. This is a sphere. The margin of the tumor is rather well demarcated. However, with the progression of the tumor, this demarcation might be lost due to involvement of invasion into the surrounding tissue. Involvement or growth of the tumor involves invasion into the cortical tissue, also into the capsule. الكبسول بده يكون This is the kidney capsule, which is stretched out because of the growth of the tumor. And حوالين الكدني شو في عنا؟ في عنا البيرينيفريك path, which can be involved in the kidney. شو كمان في على الupper pole, الادرينال gland, which can be involved. So with the progression of this tumor, the invasion can occur in all directions. This is the microscopic appearance, and this figure explains why the tumor is designated as clear cells. Tumor cells, they are relatively large due to the presence of abundant cytoplasm. However, in the cytoplasm, it is empty. عشان هيك تسمى clear cell. In real life, it is not empty, okay? Because this cytoplasm is filled with either with glycogen or lipid. However, during processing, it is dissolved, leaving a cytoplasm clear. عشان هيك سميناها clear cell carcinoma. And you can see that islands of the tumors are separated by this delicate fibrous tissue. هذا اللي لونه pink زي أغمى هو عبارة عن fibrous tissue. So the classical appearance of the tumor بيكون clear cells. And when these cells are predominant, احنا بنسميها clear cell carcinoma. Sometimes it can be mixed with other type of tumor. طبعا clear cell carcinomas are usually solitary, يعني singular tumors that are present on the cortex. It can be asymptomatic حتى تبدأ to involve some adjacent organ. زي ما قلنا, the size of the tumor can be variable, starting as small tumor. However, tumors they tend to grow, to increase in size and to invade as you. زي ما قلنا, in cut surface, it can be a little bit yellow, and if we compare it to that of the surrounding, this is because of the clear cells and their fat content. With the growth of the tumor can show cystic degeneration, it can show areas of hemorrhage. With higher grade, we can have necrosis as well. حكينا عن المارجن، حكينا عن الانفيجن inevitable. كل ما التيومر زاد بالحجم with the progression invasion it will occur, and this can also end with invasion of draining veins. Renal cell carcinoma can invade the vein, and actually they can grow within the vessel and form columns of tumors that obstruct or close the lumen of the veins. And sometimes it can cause complete obstruction, and patient might suffer from manifestation of the obstruction of the veins and can reach the inferior vena cava as well. حكينا about the content and the cell, and that's why they appear clear or vacuolated. Very important part of these tumor are the nuclei, and grading of the tumor is very important because it reflects on the prognosis of the patient. And one of the important things to evaluate in grading are the nuclei, the presence or the degree of the polymorphism, hyperchromasia, and presence of nucleoli. Tumors are grading depending on the size, the presence, and the size of the nuclei into different grades. Also, in addition to clear cells, طبعا لما نسميها clear cell carcinoma, clear cells should be predominant cell. However, it can be also mixed with other cells, نسميهم granular cells. These granular cells, they are similar to that of the lining epithelium of the collecting duct. They are characterized by having a granular cytoplasm with that appear pink in color. Sometimes tumors can be higher grade, highly anaplastic, and they can show different bizarre types of cells, and even the tumor cells can differentiate into other types, and these are called sarcomatoids. Why? Because sarcomatoid tumor are high-grade type of tumor, and they act in a very aggressive way. These sarcomatoid tumor can show cells like sarcomas, fibrosarcoma, lymosarcoma, rhabdomyosarcoma, and so on, with all types of bizarre cells. طبعا all aggressive and high-grade tumor are highly vascularized. معروف by now ليش tumors they are highly vascularized. Second type are papillary renal cell carcinoma. Again, this tumor is characterized by papillary formation. Okay, papillary are finger-like projection that show tumor cells overlying a fibrovascular core. إذا بتكون tumors they are عاملة like finger-like projection, and that's why they are called papillary carcinomas. These are not so frequent. They form about 10 to 15% of all renal tumors. زي ما قلنا characterized by papillary growth. They can be multifocal and bilateral, involving both kidneys. These tumors, usually papillary tumor, they start as early stage or low-grade tumors. Also, this can be a familial or a sporadic form, it can be inherited, partly can be inherited, or it can be sporadic, no relation to inheritance. This type of tumor is from proximal tubular epithelium. This type of tumor, in contrast to that of clear cell carcinoma, it does not have a chromosome 3 mutation. It has another type of mutation, which is a mutation of an oncogene called mid-oncogene or proto-oncogene, which is located in chromosome 7. Mid-oncogene mainly involved in tyrosine kinase activity, which is important in signal transduction through the cytoplasm of the malignant cells, and mutation of this gene, which is a receptor gene for the process, will cause continuous signaling of the nucleus for division. And this is the process by which the tumor is associated with oncogenesis. طبعا this receptor is connected to a growth factor اللي هو hepatocyte growth factor. And actually this is very important factor. It was found the hepatocyte growth factor, it is a growth factor that initiate or help that tumor in metastasis or invasion. So these oncogenes are important in the carcinogenesis. زي ما قلنا, it is characterized by papillary formation. They can be bilateral and multiple. This tumor can also show cystic degeneration, and they can show hemorrhages. These tumors are less bright in color لأنه tumor cells they do not show any deposition. فعشان هيك if we compare the color نلاقيها less bright. Can be يعني cells in this tumor mixture of clear cells, ممكن يكون في شوية color and so on. The most important is the papillary configuration. The third type, it is called Chromophobe renal carcinoma. This is the least common type of tumor. However, it should be differentiated from the others. It arises from the intercalated cell of collecting duct. These cells are darkly stained by darker. It can be brown in color if we compare it to clear cell carcinomas. These tumors, they do not have a specific gene mutation. They show different types of chromosomal loss. عشان هيك these tumors, they are haploid, يعني number of chromosome is less than that of normal. These losses can be of different chromosomes. حكينا tumors usually they are brown, mixture of cells. We might have some clear cells, and ultrastructurally we can have also microvesicles. What is the importance of differentiation? Chromophobe renal carcinomas, they have better prognosis than others. How the patient with renal tumor present? There is a triad of presentation. This triad, once it is present in patient with proper age, we should suspect the condition. First is painless hematuria. Usually hematuria is painless. Hematuria is presence of blood in urine, and this will cause discoloration of the urine. The patient might himself notice إنه في عندنا color discoloration, or it can also show إنه في عنده blood in urine, يعني gross blood. On examination, these patients they show presence of mass, abdominal mass, particularly on the posterior aspect, and they usually have flank pain. So when we have these three conditions, we have to go further and do مثلا radiology or do some tests in order to confirm the presence of the mass. In addition to this, renal tumors might start to secrete unexpectedly some hormones, and that's why they have a paraneoplastic syndrome, and these patients might present with this manifestation. فممكن يصير عندهم fever, ممكن يصير عندهم polycythemia, and this is because of the tumor excretion of erythropoietin. Erythropoietin شو هو الهرمون that affect البون marrow and the number of hematopoietic cells increases, particularly RBCs. In addition to this, other types of hormone also can be excreted from the tumors, زي مثلا الباrathyroid hormone. Parathyroid hormone will cause release of calcium from the bone. عشان هيك البيشنت ممكن يكون عنده hypercalcemia on blood test. He might have hypertension, Cushing syndrome, مثلا due to corticosteroids. Patients, مثلا female, they might have muscularization. Our males, they might have feminization effect. This is due to excretion of the tumor of androgens. Okay, فبصير عندهم manifestation of the second of the other sex. Regarding rest of the urinary tract, there are urinary bladder tumors are important, not so frequent, however they are important because of the we need to diagnose and we need to follow up this patient. There are three types of bladder carcinoma. طبعا the bladder is lined by urethelium, similar to that of ureter, كل pelvic system, and part of the urethra. So tumors that affect urinary bladder also can arise in other sites. There are three types. The most common, it is the urethelial carcinoma, أو هي transitional cell carcinoma, بس إحنا نحكيها urethelium. أو urethelial carcinoma, it is the same. Which is the most common? Less frequent is squamous cell carcinoma. Squamous cell carcinoma occur in about 3 to 7% of the cases. من وين بدها تيجي squamous حتى تعطينا carcinoma? From metaplasia. Okay, metaplasia occurs following chronic irritation, and this is known to occur in patients who have some ovas. وهون أكثر شيء هي الova of bilharziosis because they reside in the wall of the bladder. فعشان هيك these might have squamous metaplasia and squamous cell carcinoma. Also, adenocarcinoma, which is rare, can occur in the bladder. Males usually affect more than female. Age of occurrence, middle and beyond, okay, classically. What are risk factors? Again, cigarette smoking is well known. Occupation carcinogen, عشان هيك لازم نسأل المريض وين بيشتغل بالضبط, which might explain why it happened this. زي الانيلين دايز تذكروا إنه one of the hazards of environmental exposure. Patients having malignancy and receiving chemotherapeutic agents like cyclophosphamide, radiation therapy. Patients having family history also they have increased risk. قلنا squamous cell carcinoma عادة occurs in infestation by schistosoma hematobium بالذات اللي هي بتعيش بالبلدر. عشان هيك we expect in endemic area they have increased incidence of squamous cell carcinoma. It might be also related, as we know by now, in tumors they have different genetic mutations. The very important aspect in this condition إنه في عندنا precursor lesions, and if these are found before the development of tumor, we should be aware that this patient he can develop carcinoma, and actually لما يكون في عندنا carcinoma in situ, we have to follow up the patient. What are these precursors? Precursor is the presence of non-invasive papillary tumors, because these can progress and can give us invasive carcinoma, and also the presence of carcinoma in situ. This is something very important, because these patients with carcinoma in situ, they can develop invasive carcinoma. عشان هيك, if the patient diagnosis at early stages having these, we should really be careful and follow up the patient حتى to deal with. The most important prognostic factor in this papillary lesion is the grade. The lower the grade, the less likely to have invasion. وكل ما كانت the grade higher, the likelihood is increases. The grade is طبعا depends on the degree of dysplasia behind epithelium and the dysplastic feature presence on in the nuclei. And that's why grading divides the tumors into 4 types. Either papilloma اللي هي نعتبرها benign, في عندنا papillary configuration, lining epithelium completely normal, هذه شو بنسميها papillomas. However, sometimes the overlying urothelium can show some nuclear changes. Okay, هذول بنسميهم papillary urothelial neoplasm of low malignant potential. We have some nuclear changes. This might indicate that the tumor is now progressing into higher grade, okay, or something more sinister. Invasive types نسميها papillary urothelial carcinoma, and can be of low grade or high grade, depending again on degree of dysplasia in the urothelium. These 2 types can show invasion, okay, invasion into the subepithelium or into the muscular wall. زي ما حكينا الكارسينوما انه سايتو when the dysplasia or nuclear dysplasia is confined or involve the epithelium or urothelium or transitional epithelium. However, there is no invasion and there is no increase in the thickness of the urothelium. Okay, هاي بنسميها carcinoma in situ. Usually these lesions are flat, ما فيها papillary configuration. However, these are important in diagnosis. If they are present, we should know they can evolve into invasive. Or if the patient is known case, this is a way for follow-up of the patient. Okay. طبعا without treatment, زي ما قلنا, these can progress into invasive cancer. That's why it is important. This is a urothelium or transitional epithelium. زي ما قلنا, this is the epithelium, show all nuclear changes involving the full layer. This is the basic definition of carcinoma in situ. كل الlayers ملاحظين كيف النيوكليا pleomorphic, hyperchromatic. السيرفس عادة normal urothelium, السيرفس بيكونوا cells rather larger with abundant cytoplasm, حتى نسميهم umbrella cells, and show maturation. هون ما في maturation. Why it is in situ? لأن basement membrane اللي هو over which the epithelium is lying is intact. هاي بيكون عبارة عن خط رفيع زي خط القلم. Okay? ما في invasion. It is flat, no increase in thickness. This is carcinoma in situ. Okay? هلا invasive tumors, they are low or high grade, and they might show adjacent carcinoma in situ. This is can occur. Invasion occurs in the epithelium. Invasion, it involves what? And the basement membrane is degraded, okay, and the tumor cells now pass into the subepithelium, and it can go into the muscle اللي هي muscular wall or muscularis propria of the urinary bladder, and it can go outside the bladder into the surrounding tissue. Okay, this is invasive. طبعا the extent of this invasion is very important because if the diagnosis of invasion occur at early in the disease, we know that this is an aggressive. But one of the prognostic factor in bladder cancer is the presence of invasion and the excess of invasion. Okay. This is a figure to show you this is the papillary configuration. عشان هيك usually or commonly we see these configurations. فشو بنسميوها؟ Later on لما تتفرجوا على ريبورتات البيشنت. This is papillary urethral carcinoma or papillary transitional carcinoma because of this configuration. This is the epithelium and this is the core. The core of papillae formed of what? Fibrous tissue which is vascularized, so blood vessels. And if we look at the epithelium, نشوف كل features of nuclear dysplasia. And this is a higher magnification of the area. Or you can see in tumor cells وفيها mitosis. طبعا this depends on the grade of the tumor. ممكن تكون low or high grade. Usually these patients present with what? With bilious hematuria, okay? Why? لأنه the tumor cells and the arise from the lining of the bladder. They can bleed, they can have necrosis مثلا. فبالتالي tumor can bleed. فالmanifestation early manifestation is bilious hematuria. عشان هيك دائما لما يكون عندنا bilious hematuria, again you have to go and this is a serious manifestation. It can be of different things, but the most important إنه نعرف إذا عندنا a tumor or not. Okay? Other the risk for recurrence طبعا كل اليوريثرال carcinomas they tend to recur. والrecurrence is frequent. يعني المريض راح يقضي بقية حياته يكون عنده recurrence treated and so on. Okay? فإذا recurrence is common. What determines the frequency of recurrence? Tumor size. كل ما كان the area of involvement or the tumor larger, the recurrence is higher. Stage طبعا أكيد ليه؟ This stage it evaluates the tumor invasion, and if this is higher, this means إنه recurrence is going to be grade طبعا the higher high dysplastic. This means in the tumor it has a tendency to recur. Multifocality is important. Mitotic index, يعني كل ما كان tumor having increased mitotic activity, the liability to recur is more. إذا adjacent areas show dysplasia, carcinoma and cyto, نعرف إنه هذا البيشنت under continuous irritation أو الepithelium have different foci of genetic mutations that will progress and evolve and give us new tumor and so on. طبعا the presence of carcinoma in the cyto is very important because it indicates that the patient is going to have a recurrence.